Neonatal withdrawal. Neonatal withdrawal. A withdrawal syndrome of infants after birth caused by in utero exposure to drugs of dependence. The onset of clinical presentation typically appears within 48 to 72 hours of birth but may take up to 8 days. The signs and symptoms may be different depending on which substance the mother used. Symptoms: due to hyperactivity of the central nervous system, tremors, irritability, excessive mood, crying, sleep problems, high-pitched crying, muscle tightness, hyperactive reflexes. Seizures, controversial, due to hyperactivity of autonomous nervous system, fever, sweating, yawning, stuffy nose, and sneezing. Fast breathing due to hyperactivity of stomach and intestines. Poor feeding and sucking reflex, vomiting, diarrhea. Causing drugs, opioids, most common, e.g. heroin, methadone, buprenorphine, lower risk. Selective serotonin reuptake inhibitors, SSRIs, e.g. sertraline, escitalopram, fluoxetine. Serotonin and norepinephrine reuptake inhibitor, SNRIs, e.g. venlafaxine, duloxetine. Desvenlafaxine. Tricyclic antidepressants, TCAS, e.g. amitriptyline, doxepin, protriptyline. Ethanol, an ingredient in alcoholic beverages like beer, wine, or brandy. Benzodiazepines, e.g. alprazolam, diazepam, lorazepam. Comparison: preterm infants have a lower risk of developing the symptoms, require lower doses of opioid replacement medications, and have a shorter duration of opioid therapy than term infants. It is hypothesized that an underdeveloped central nervous system, CNS, decreased hepatic clearance of opioids, and a lower cumulative in utero opioid exposure may decrease the manifestations. Prevention: it is prevented by the mother abstaining from illicit or prescribed substances. However, some prescribed medicines should not be stopped without medical supervision, or harm may result. Because suddenly stopping a medication can result in a premature birth, fetal complications, and miscarriage. Therefore, it is recommended that pregnant individuals discuss drugs, both prescribed and not prescribed to them, alcohol, and tobacco. Treatment: non-medication, adjusting physical environments, for infants with hypersensitivity to light and sounds, darkening the room and eliminating surrounding sounds to lessen the visual and auditory stimuli. Swaddling helps improve sleep, develop nerves and muscles, decrease stress, and improve motor skills. Breastfeeding reduces the severity and intensity of symptoms. Both buprenorphine and methadone remain in the human milk at low concentrations, which will reduce the symptoms and likely decrease the treatment time. However, it is not safe for mothers with HIV-positive or history of street drug use or multiple illicit drug use to breastfeed. Medication: opioids improve symptoms to a clinically safe level, slowly taper down to wean the infant off, but may not affect length of hospital stay. Sedatives, e.g. phenobarbital, diazepam, less effective at symptom control compared to opioids, but can reduce length of hospital stay. Clonidine, effective at improving clinical symptoms compared to opioids. Additional medication is used to relieve fever, seizures, and weight loss or dehydration.